Eat Smart, Move More, your guide to bone health on dialysis. This is Madam Siti, who works hard despite being a dialysis patient. This is her usual routine, enjoying food during her break.
Madam Siti, your recent blood test showed that your phosphate level is a bit high. It will actually affect your bone health in the long run. So I understand that instant noodles and food like this are your favorite food, but it is important that you minimize food like this. And it is still important for you to take your phosphate binder.
It's okay lah. How can this little food affect my bone?
Here comes the consequences.
Ayo, my bones so soft like tahu.
I told you, crunchy bones are my favorite!
Madam Siti, time to fight the phosphate monster with 3D plus 1E power.
Dialysis and drug
Diet.
And exercise are your secret weapons for your bones.
I should have listened to them.
High phosphate in your blood can be a real nightmare. Your bones could already be weakening as we speak, a danger especially for dialysis patients. What can you do for bone health? Remember the 3Ds plus 1E: dialysis, drug, diet, and exercise. Firstly, don't forget to go for your dialysis. Secondly, avoid high phosphate foods. Thirdly, eat your phosphate binders. These are the 3Ds for bone health: dialysis, diet, and drugs. Dialysis helps remove harmful substances from your blood. However, it doesn't remove phosphate as efficiently as healthy kidneys. That's why it's important to reduce phosphate intake from food, even though most food contain phosphates. Look out for high phosphate foods under processed foods or fast food, such as burgers, fries, cola drinks, sausage, or pizza. Cocoa, malted and dairy products, including chocolate, malted drinks, milk, cheese or ice cream, as well as bone and coconut-based products, such as coconut milk, nasi lemak, bone soup, edible fish bones such as sardines, and chendol are high in phosphate as well. Other phosphate triggers include meat, eggs, and legumes consisting of egg yolks, organ meat, and red bean soup, as well as whole grain, nut and seed products such as brown rice, wholemeal bread, nuts, and nut-based breads. Look out for phosphate in dried products such as dried mushroom, prawns, or fish crackers, seaweed, dried ikan bilis, and dried shrimp. Do you know why processed foods such as your processed meats, your packaged snacks, your instant noodles, and your cola drinks are high in phosphate? All these contain your phosphate additives, which helps to improve the shelf life of the products and also help to improve the flavor. So all these hidden phosphates actually can be absorbed by the body, which raises your blood phosphate levels. What happens if your phosphate levels are too high? It can pull calcium out of your bones, making them more brittle and increasing the risk of fractures. When calcium leaks from your bones and phosphate builds up, they can combine to form hard deposits. The resulting blood vessels build up can lead to blockages and increased risk of heart disease. Calcium and phosphorus imbalances can also settle under the skin, causing itchiness, joint pain, and discomfort. Other than going for your dialysis and also limiting your high phosphate foods, what else can you do? Keep your phosphate levels in check by eating your phosphate binder medication. They work by binding to the phosphate in foods so it doesn't get absorbed into your blood. Calcium carbonate, lanthanum, and Velphoro have to be chewed to mix with your food. Calcium acetate and Sevelamer will have to be swallowed whole. These medications are designed to release slowly with food. When you take your phosphate binder with food, it acts like a sponge, soaking up the phosphate from food. Excess phosphate is carried through your digestive system and removed from your body through the colon. By going for dialysis and eating your phosphate binders, and also eating a low phosphate diet will help you to manage your phosphate levels.
Another way of improving bone density are isometric exercises as your 1E. Imagine you are pushing against a wall as hard as you can. You are using your muscles, you feel the effort, but the wall doesn't move, and neither do you. That's an isometric exercise. When your muscles contract, they create pressure against your bones. Pressure signals your body to strengthen the bone to increase its density over time. Pressure makes diamond, correct? These are some examples of exercise that you can do to strengthen your bones. If you're unsure which exercises to do or what intensity is right for you, feel free to ask the exercise and fitness department.
The best time to take charge of your health is now. Let's set the goal. Eat smart, move more. And don't forget your regular dialysis. They are the keys to preserve your bones.